Have you had your polio vaccine? Can't remember? Well, chances are that you have, and that's really important right now because it's not just COVID and monkeypox. More great public health news. For the first time in almost a decade, a case of the polio virus was found in the US. Earlier this month, health officials in New York's Rockland County discovered a case of polio in an unvaccinated 20-year-old who was paralyzed by the virus. It was also detected in a nearby wastewater system, which officials say means the virus has likely been circulating undetected. New York State's health commissioner said that for every one case of paralytic polio identified, hundreds more may be undetected. Now, most people who get polio don't have symptoms, but they can still shed the virus and give it to others weeks after getting it. Thankfully, for most people in the US, this new polio case hasn't raised the risk of getting the virus. Polio vaccines were introduced starting in 1955, and just look at the graph showing cases before and after vaccines. The CDC says that polio was eliminated in the US in 1979. Since then, any instance of polio discovered has been brought in from somewhere else. With the case this month in New York, there have been 4 reported cases in the US total since 2000. And polio was eliminated from the entire Western Hemisphere by 1994, thanks to mass vaccination efforts. According to the CDC, most adults in the US today were vaccinated as kids, and more than 90% of children are currently vaccinated, which means they're pretty much protected for the long run. So how did this individual in New York contract the virus? The first thing to know is that none of the cases over the past decades have come from the live virus itself. These cases have come from a version of the vaccine that we don't use in the US. The vaccine-derived polio virus comes from an oral vaccine that's still given in other parts of the world. If that kind of vaccine is given to someone who is under-immunized or immunocompromised, it can cause polio. Each of the cases found in the US since 2000, including this case in New York, were linked to vaccine-derived strains. Now, just to be clear, the polio vaccine given in the US, which health officials are urging everyone to take if they haven't taken it already, is not the type of vaccine responsible for these infections. Vaccines are still the best defense and more urgent than ever. So, how concerned should we be that the virus appears to be circulating? Could it become a bigger crisis? And how big a challenge is the anti-vaccine movement in the US to helping keep the polio numbers at their low levels? Dr. Stella Saffo is a primary care physician and assistant professor at Mount Sinai Hospital. She's also the founder of Just Equity for Health. Thank you so much for coming on the show. Dr. Saffo, what does this polio case in the US mean? Is it surprising? Is it concerning? Is it still considered eliminated in the Western Hemisphere?
It is not surprising, it is concerning, and polio is unfortunately definitely not eliminated from the Western Hemisphere with this latest case. It's not surprising because the trend in the last few years has been in certain parts, certain communities, certain parts of the US towards getting less childhood vaccines. This has gotten worse with what we've seen around the kind of negative attitudes with COVID. And so it's just a matter of time before some of these different diseases that we thought we had kind of gotten ahead of and conquered are going to start spreading. We've seen this with measles spreading a lot more than we have in the past. And so polio is just the latest one that reminds us about the power of vaccines.
Yes. The power of vaccines, well put. It's not just here in the US, though, right? The case in Rockland County, New York, is linked to vaccine-derived polio that was also recently detected in Jerusalem and in London, and wastewater samples show the virus circulating in all 3 areas. Is it fair to call this global at this point?
It's definitely global. I mean, this is one lesson that we should have, which is that a lot of times in countries that are better resourced, we will get ahead of a lot of these different pathogens, these different viruses, and we'll feel very safe for ourselves. But these different pathogens still exist in other parts of the world. So classic example is monkeypox. Monkeypox was in West Africa. We never paid attention to it until it came here. Polio has been in parts, usually in places that are kind of under-resourced and politically unstable. Polio has been there already. And so there's a little bit of a reminder of kind of how connected we are globally because, these conditions are out there. We happen to be lucky that we're vaccinated, and yet we can see what happens over time that, these things are not going away. It is worth noting, though, that this is not wild-type polio that's spreading. It's vaccine-derived. And I love what you mentioned to, your audience about how it doesn't mean the vaccines in the U.S. will give you polio. It is the different version of the vaccine that was historically given that's no longer given here. So if you're not vaccinated against polio, you want to get it today.
So we'll come to the anti-vaxxers in a moment. Just on if you're not, how do people know if they're vaccinated? Is it something we all got as kids? I know that it's one of the criteria for going to school. Are most people vaccinated in America? I said 90% of kids earlier. That still leaves 10% who aren't, which feels like a lot.
It feels like a lot. Well, what's funny is that folks have been texting their parents, hey, Ma, am I vaccinated, right? Because many of us don't really know that information.
Yeah, me included.
You can kind of think, yeah, exactly. You can think that in the last 20 years to 30 years, if you went to school here, if you grew up here, you're probably vaccinated against polio. The vaccines were rolled out, mid-century. So you're probably vaccinated. However, if you're someone who's immune compromised or you're someone who has kind of more reasons to be concerned, you may want to check in with your primary care doctor. And if you know that you were not vaccinated, the best thing you can do is to go get vaccinated today, right now. Why? Because polio is out there. It is not a concern for those who are vaccinated, but if you're not vaccinated, you could not only get the disease and get paralyzed, you can get the disease and die. And it's one of those diseases that there's no reason for folks to suffer from it.
Says there's no harm so basically what you're saying, just to clarify, if you don't know you've had it, you can just get it. There's no harm if you've already had it and getting it again.
There isn't. Because we don't tend to booster for polio, it's not one of those ones that we go crazy over. But if you're just really not sure and you're in an area like New York where it's spreading and you want to go in and talk about getting vaccinated again, there's no harm in that.
Okay. Let's talk about the anti-vaxxer movement that's been growing in the US over the last decade, and especially over the last 2 years during this pandemic. How does that potentially play into polio or other diseases we've been able to keep under control until now? Could we see something like polio resurging because more and more people aren't vaccinating their kids and are lumping all vaccines in with their concerns over the COVID vaccine?
Yeah, it's actually pretty disastrous. It's one of the things that we talked about with the way that COVID was being politicized and the impact of the kind of hardening of the anti-vax movement around COVID, right? Because if you think about what's happening, people are really convinced themselves that vaccines en masse are the issue. And so vaccines are the thing, though, that pediatricians and public healthcare workers have pushed for decades to protect us as a population. So what happens if a population doesn't get vaccines anymore? We're going to find out, it looks like, and we're finding out with cases like polio, and we're going to see it with other things. We've seen it with pertussis, measles. I cannot stress enough the damage that COVID anti-vaccine kind of attitude is having and has had. It is also worth noting that the folks who are really, it seems like the folks who really tend to be anti-vaccines are also anti the kind of preventative measures to keep yourself safe. And so there's an interesting conversation about what happens when we have a new pathogen, a COVID, a new type of COVID, and we need to kind of think about public protection. Will folks accept the preventative measures that need to be brought at that time? And so I think we're just at a little bit of a dangerous point, public health-wise, that we all have to kind of consider and own.
One last quick question. Do you think the pandemic has made us more alarmist when it comes to diseases, viruses, illnesses? Like we panic too much when we hear monkeypox is coming or polio is coming? Or do you feel the opposite has happened, that people are becoming numb to this kind of news? Well, it's not COVID, it's not killing 500 people a day, so it's not that big a deal.
It's such a great question. I think it's both. I think there are folks among us who haven't gotten through and haven't had the trauma from COVID, hear of any new disease and are losing their minds. We heard of a case of Marburg in Western Africa, and folks here were like, Marburg is coming, and it isn't. It's a hemorrhagic disease. And then there's the other kind of end of it, the other end of the spectrum, where folks are completely just immune to any sense of danger from these different infectious diseases. And that is very dangerous because they are coming. We will see more of this. This is just the beginning. I wish there were a middle point where folks could really understand what our data tells us and what the kind of science tells us, and so we can kind of match our fear level to the reality. But I think that we have the two spectrums, folks who are super scared and folks who are not scared at all, and probably both sides won't really help us at this point.